And I will start with going back to share screen. We'll get out of that talk and go back to classroom. And how to answer short answer questions, that's SAQ. It's a shorter talk. Let's open it with Google Slides. Okay, tips for answering short answer questions. Okay, so when you're looking at a question, take a moment to deconstruct the question. It's going to have 3 important things you need to notice in it. The first is a task word, okay, which is words like describe or explain how. And then it's going to have topic words, the actual thing you're going to talk about. And then it's going to have limit words, which define the scope, okay? So what would you expect to see, that's a task word, in a lacrimal gland biopsy from Sjogren's disease, okay? So you would answer that by echoing the question back, right? These are the things that I expect to see in a lacrimal gland biopsy, implying histopathologically in a patient with Sjogren's disease. And all they're asking is a list. Yep, a list. Another question, outline, which means write some bullet points on, or a few sentences on, 3 things: the pathogenesis, the clinical and the pathologic features of retinopathy of prematurity. So you would answer this by writing retinopathy of prematurity, pathogenesis, some sentences, clinical appearance, which means clinical appearance means probably, you know, through the Volk or the slit lamp or something. And then the pathological features in here means the histopathology. So you'd write 1, 2, 3 paragraphs. And you don't get any marks for going off track. You don't lose marks, but you don't get marks. But if you deconstruct the question, you can think about what it is. Okay, so
before we go on, Mark's got a question
yes,
about terminology, which we should get right in the beginning.
Yes.
Can I ask that directly? Where did Mark go?
He's muted.
Oh,
okay.
The difference between etiology and pathogenesis.
Okay, so that's a good question. Etiology and pathogenesis. So the pathogenesis is like the mechanism of how it's caused, and the etiology is the things that lead up to its being caused. So something simple like atherosclerosis, right? The etiology of atherosclerosis is high blood lipids and high blood pressure and homocysteine damaging endothelial cells, okay? And the pathogenesis is damaged endothelial cells release cytokines and recruit inflammatory cells and macrophages. So the etiology of a skin cancer is UV rays hit the DNA of the basal cells of the skin and cause mutations. Or in people who are immunocompromised, the immune detection of early cells with mutations and means that they aren't eliminated. So it's the thing that kind of causes it, whereas the pathogenesis is cells with mutations grow. Now, if I was writing a question in this exam, right, for temporal arteritis, describe the ophthalmic features and the pathogenesis, I would talk about the etiology and the pathogenesis, okay? Because pathogenesis in these questions is used very loosely to include etiology and pathogenesis together. So I would write about the UV rays and the immunocompromised person, as well as the progression of mutation. Does that answer your question?
Yeah, Mark is nodding.
Mark is nodding. Okay, right. Okay, so what you saw me doing there was kind of rephrasing and reframing the question in my own words, right? I'm interpreting the question. And so I'm doing that quite deliberately, looking at the task and the topic. So what I actually thought to myself was, all right, they want to know what is the histopathology of Sjogren's disease in the lacrimal gland. And they want me to write bullet points on the pathogenesis, there's the clinical / slit lamp appearances and histopathology, and histology of retinopathy of prematurity. So that's going on in my head. So it's important that you know that you're doing that and understanding it correctly rather than just heading in there. Often it's good to plan the structure of what you're writing. So you saw me doing that too, okay? So I was thinking, all right, histopathology of Sjogren's. Now we all know how to examine a slide now. I'm going to write what happens at low power. I'm going to write what happens at high power. And I'm going to make some important other points, like it's not a clonal proliferation. I was given the structure much more with retinopathy of prematurity. So I'm just going to write the pathogenesis, the clinical, and the histology. So plan the structure. And if you're asked to describe the pathology, remember to go what you see, the very low power with your ophthalmoscopes, the low power down the microscope, and then the high power.
Now, Diane, Jess has got a good question.
Okay.
What about epidemiology? Is that part of clinical features?
No, not really. I'm just thinking here, is epidemiology part of clinical features? When I think of clinical features, would I toss it in? So probably a few words. So if I was to ask the clinical features of basal cell carcinoma of the eyelid, I would think about what I would see in clinic and say basal cell carcinomas commonly occur on the lower eyelid of white Caucasian people who have lots of sun exposure. So I guess I am tossing the epidemiology in there.
Probably the age is good, because you wouldn't retinoblastomas in adults or BCCs in children.
So it's kind of, I would include the epidemiology like what I would see on the patient in clinic, but I wouldn't say, you know, the incidence of basal cell carcinomas is 200 per 100,000 in white people and 40 per 100,000 in, you know, Asian and American people. Asian and African people. I wouldn't do it formally, but I would probably talk about the common patient that I saw.
Thanks.
Sorry, what about, would you, part of the clinical feature, would you talk about the common side, for example, it's more common in the lower lid followed by the medial canthus, then upper lid and lateral canthus, things like that. Would that also be part of the the clinical feature?
So yes, so if I was describing the basal cell carcinoma, I might say, you know, only 1 in 10 BCCs occur on the So yes. So you might say it is more common towards the medial canthus because it's the clinical thing that you're actually looking at. So they want to know, have you made accurate observations of real people in a real setting?
Sorry. So basically, just to rephrase, the etiology and risk factors are the same thing, basically.
Etiology and risk factors are basically, yes, the same thing.
Yeah, thank you.
Okay, so use plain language, keep your writing straight to the point. I used to, in this thing, say write legibly, but I don't have to anymore because you all type it, and that is truly a blessing to the examiner because I can read every word you say. But use words from the question in your answer to signpost your answer for the marker. They will have 3 points allocated to pathogenesis and 3 points allocated to clinical. So use those headings when you write, and just like put them in bold and write bullet points, and it'll all be good. And the last thing is practice. So we talked about that earlier. Decide that you're going to write about, learn about BCC, practice writing a question and work out what you don't know, because then you only have to learn a small thing. You have to learn what you don't know and come back and practice again later. So practice. We all know it's the only way to become a Jedi. Right, so, but I don't understand what they're asking. Okay, so you have to understand what they're asking. So here's some questions. So what do they mean by the macroscopic features? So when they say the macroscopic features, they often in pathology mean what you can see clinically. Okay, the macroscopic features of basal cell carcinoma are two common kinds, you might say, that it can either present as a pearly nodule with a central umbilication, or it can present as a, diffuse scaly patch on the eyelid. Yeah. So there's a variety of macroscopic features, you might say, but it's what you see with your eyes. And the microscopic features are what we see down the microscope. Okay. So the macroscopic features of a melanoma of the choroid would be what you see through the ophthalmoscope. Okay. Describe the, right, here's another one. Describe the life cycle of toxoplasma and the ocular manifestations of infection. What do they mean by the ocular manifestations? Well, what they mean is the clinical and the microscopic features. Okay, so mostly they're going to ask this. So the ocular manifestations is what you would see on clinical examination, and the plus the microscopic things. And then you would probably talk about the complications. So temporal arteritis, this is a lovely one. Describe the possible ophthalmic features. Okay, so they want to know the macroscopic, what you see clinically, and the microscopic of temporal arteritis in the eye. They've asked you to talk about it here in the artery. Here they're talking about it in the eye. And then the pathogenesis, where you would talk about the type 4 immune reaction. Okay, here's another good one. What are the pathologic changes you would see? Okay, so the pathologic changes would be the macroscopic changes, what you would see clinically, and the microscopic changes. Another confusing term is the term neoplastic conditions. Okay, so neoplastic conditions means benign plus malignant conditions. So for example, a smooth muscle tumor of the iris is benign, but it would be a neoplastic condition. Is a hamartoma a neoplastic condition? Good question. Is a hamartoma a neoplastic condition, Amanda?
I don't think so.
I don't think so either. Yeah. Okay.
It's not a clonal proliferation of a new growth.
It's not. So you wouldn't include cysts or anything like that.
Right. So iris would be nevus and melanoma. That's sort of the thing.
Yeah. Discuss the pathogenesis and pathology of retinopathy of prematurity. So again, the pathology here means what you see clinically and down the microscope. Okay, so I'm going to stop sharing now, and I'm going to stop recording.